Yeah. To ask the Minister for Health to outline proposal regarding the reduction in the ambulance service in Kenmare, Caherciveen and Killarney, County Kerry. Right, let for the Karen O'Malley.
Thank you, Let's go here again. Before I start, I'd like to welcome the research staff of St. Vincent's who work with Senator Crown to the House. It is apt, of course, that my questions on ambulance services, although a long way from St. Vincent's. I'd like to welcome the Minister back to his house. We're missing him since he left. I suppose the question I'm putting down today is in relation to the issue of the people who are going to be affected by this proposed cut in service, because in reality the proposed cut in ambulance services in Kenmare, Killarney, Caherciveen means people are going to die. That's ultimately the stark reality of the facts. The ambulance service in Kenmare currently is 24/7, and what we are hearing through that HSE grapevine is that this service, that the service that is there 24/7 at the moment in Kenmare, Caherciveen and Killarney is going to be reduced to an ambulance car at weekends and after 8 o'clock in the evening. What that means ultimately is that if a person suffers a stroke or a heart attack, or there's a serious ambulance in the Kenmare area, in Caherciveen or around the Killarney area, they're going to get a reduced service. In an example that was given to me by experts in the field, what we're talking about in that regard is if there's an accident down in Lorrock at a weekend and the ambulance has to come from Killarney, that would mean that it would take up to an hour. But first of all, an ambulance car would go out, and an ambulance car going out is, as was described to somebody in the profession, is the equivalent of sending a fireman out with a fire extinguisher to a blazing house fire when you need to send the fire brigade. The ambulance car, which would go out, would then, if the ambulance is required to transport a person to the hospital in Cork or in Tralee, would then be called from Killarney. That ambulance in itself could be out on call, which means that the ambulance from Tralee would have to come. Tralee is an hour at speed from Kenmare, and from Lorrock it'd be an hour and 20 minutes. At this stage, as I'm sure the good doctor would know, your outcome would be very poor indeed if you are sitting on the side of the road after an accident waiting for an ambulance 2 hours after the accident took place. The reason I'm asking the question is we are told that the service is going to be downgraded, that this reconfiguration is going to happen in the next few months. There are public meetings being planned in Kenmare to prevent this from happening, because we know that once the ambulance is gone, it will not be returning. And ultimately, people will die because the ambulance, and we've done analysis of it over the last 12 months, that outcomes would have been far worse for people in the community if they hadn't been transported to hospital by ambulance within an hour of their accident happening, or their stroke, or a heart attack. They were actually on the operating table within an hour and a half of the event happening. But if the ambulance service is withdrawn and downgraded, it will mean that it'll be 2-3 hours. And as the Minister well knows, what will happen then is the outcome will be worse. The person who suffers the heart attack or the stroke will tie up hospital beds, because instead of him just simply getting a stent put in and recovering in a matter of a day or a week, he will now tie up a hospital bed. He'll need rehabilitation, he'll need physiotherapy, and then he's going to cost the taxpayer more. So we all know prevention is better than cure, and downgrading an ambulance service and getting people the attention they need as quickly as possible will mean that the taxpayer ultimately saves money. But we're going to be penny wise and pound foolish, and what we're being told is we're at the very tail end of this process, and money had to be allocated in other constituencies to beef up services in West Cork, because there was a campaign run there, and as the last Caherciveen would be well aware, and he was involved in it, and now it's going to be in South Kerry. They're going to try and make the savings, and ultimately lives will be lost, and we will have worse outcomes in South Kerry as a result of the proposed and the threatened downgrading of the ambulance service. Thank you, Les Caherciveen.
Thank you, and I'm taking this adjournment debate on behalf of my colleague James Riley, TD, the Minister for Health, and I want to thank Senator Daly for giving me the opportunity to address this matter. Firstly, I want to point out that the National Ambulance Service, the NAS, is not a static service. The NAS deploys its resources dynamically and on a regional and national rather than a local basis. Dynamic deployment of ambulance resources ensures that the nearest appropriate resource is sent to an incident. The Senator may be aware that following a Labour Court judgment, the NAS has been implementing the phased replacement of on-call with on-duty rostering in the southern region. On-call rostering means that the crew is not at work, but is summoned for a call-out, with an average time from call-out to a vehicle leaving the station of over 20 minutes. On-call significantly affects response times, operational capacity, compliance with the Organisation of Working Time Act and health and safety for staff. An on-call risk assessment has been carried out for inclusion on the NAS risk register, and discussions are also pending with the Health and Safety Authority on its concerns over the use of on-call services. On duty means that highly trained paramedic crews are in their stations or their vehicles to respond immediately to emergency calls. On-duty ambulances and response vehicles are deployed dynamically according to need and demand patterns rather than the station location, and can be in optimal locations at any time based on predictive needs assessments. This allows more flexibility and responsiveness and will produce better response times for the people in Kerry and indeed a better service. The NAS has been taking a number of other steps to improve response times. These include a performance improvement action plan, more efficient rostering, an intermediate care service for non-emergency clinical transport, the National Control Centre reconfiguration project, and a trial emergency aero medical service. For the Senator's specific query, the NAS advises that the current on-call static service in Kerry will be replaced, and it is considering the most appropriate model for ambulance services in the Kerry region. Consultation will take place with a wide range of interests, including the public, staff, general practitioners and other healthcare colleagues. Other factors to be considered include the results of efficiency measures in other regions, new arrangements under the public service agreements, activity and demographic analyses, and also developments in emergency aero medical support. The Senator will note that in line with the Labour Court recommendations, any new service model must be delivered from within existing resources, not limited to main towns and not based on the current static on-call structure. When this process is completed, an appropriate model will emerge. The HSE is committed to briefing Oireachtas members, public representatives and community leaders before implementing any final service model.
Will to Sasta, Shannon
In my Sasta.
Brief chance to respond, because he's not the line minister, so he might not be in a position to answer you. But
well, I'm sure that the Minister will be able to find the answer for me. I couched in all that, and I'm grateful for the Minister's reply, but I'm also grateful for the briefing I got from experts in the field. And hidden in all that is civil service speak for box ticking and for making sure that you reach benchmarks. Average call-out times, when they're referring to average call-out times, what they're actually saying is, well, we're going to have someone seen by a paramedic or a trained professional. But what they're not saying is, it actually won't be in an ambulance. So when they do come out, and it might be half an hour before they get to some locations and an hour in some places in South Kerry, that it'll be an ambulance car, and the person might need to be transported. Then they have to call for the ambulance to transport them. And now we're losing more time, and any doctor will tell you the more time you lose for a critical patient, the poorer the outcome. I love this. This has got to be great. On-call risk assessment will be carried out in relation to where they're going to put the ambulance. What seems to be said here is that somehow the HSE have a crystal ball where they know people are going to have heart attacks and strokes around South Kerry, and that they've got a risk assessment and say we're going to have the ambulance sitting at the Healy Pass or somewhere around the tunnel in Glengariff, and that we know that on a Friday night that's generally around the part of the world where they're going to have heart attacks and where there are going to be accidents. the predictive needs assessment. That's basically what they're talking about there, that we're predicting where accidents occur and we're going to locate ambulances there on Friday and Saturday nights and Sundays and between 8 and 8. What I also see at the bottom is that they're going to tell us before they implement the final service, but they're not talking about the range of options. So what we're going to get from the HSE is a briefing when they're about to implement it, and not anything to do with the actual practicalities on the ground as to the effects that this will have on people. What they are trying to say is we're going to have an ambulance on call, right? An ambulance, but it'll be an ambulance car. And an ambulance car will be no good to a person who's lying on the side of the road in Larrock or Sneem or Caherciveen or Killarney, and the ambulance that they actually need is gone away somewhere else. That's basically what we're talking about. What is actually happening here is that people are going to die because we are taking away the frontline service, the 24/7 services, the people that were protesting this week in Tala. We are taking them away, and yet we are going to ensure, and that's basically what's going to happen, people are going to die as a result of the ambulance service being withdrawn from South Kerry, from Caherciveen, Kenmare, and
I've been more than lenient with you.
You've always been like that. Yeah. That's good here. And I know the minister, he's not the man in charge of giving the answer, but maybe he might.
We might ask the minister to convey the concerns of Senator Daly to the senior minister, Minister Riley, and.
I shall do that. I just want to make 2 quick points.
No problem.
Very briefly. I mean, I think moving from a model of an on-call ambulance service where you may have ambulance personnel sitting in their living room at home waiting for the bleeper to go off, moving to a point where they're actually either in their vehicles or in their local station and capable of responding quickly to challenges, to emergencies, I think is a very, very positive development. I did make the point in my contribution that there will be extensive consultation with the public, staff, GPs, and all other health professionals in the area before the final model is arrived at. There's no question about that. And finally, just to make the point, you can carry out reasonably scientific analysis of, population, past history of ambulance calls being issued from particular regions. One would expect that one won't be citing ambulances on the top of a mountain where you have, a population density of 2 people per square kilometre. You can use a lot of data, past data, to finally make the decision as to where is the optimum location to site ambulances in the future. I think all of that will be done. I think there's a lot of, just from the Senator's contribution, a lot of speculation without little basis on real fact as to what might happen. Let's see what the process involves. There will be consultation, and you may be surprised at the outcome of that consultation process.
Yeah. Margaret?
Pleasantly surprised.
We were pleasantly surprised in West Cork last week.